replacement therapy drugs. Women across the UK are going to desperate lengths to get hold of HRT, which many take to help ease symptoms of menopause. But this programme can reveal that the drug shortage extends much further, with almost twice as many medicines in short supply compared to last year. Here's our Health and Social Care editor, Victoria MacDonald.
Celebrities including Davina McCall and Mariella Frostrup joined campaigners outside Parliament last year to celebrate the news that hormone replacement therapy prescription costs were to be cut. More than 1 million people in the UK are on HRT, the vast majority of them women who need it to help deal with the often debilitating effects of menopause, sleeplessness, depression, hot flushes, to name a few. But the good news has been undermined by an ongoing shortage of the product, with reports now of women buying HRT on the black market or swapping the gels, patches and tablets with each other.
The government don't make HRT, so we are dependent on suppliers and manufacturers, and I've met with them, and they've said two things to me, really. Firstly, that the demand for HRT is really increasing, which is something we want. We want women going to see their GP, we want GPs prescribing HRT, and that demand has really soared in recent months. The second thing is with things like COVID, that some of the ingredients for some of the HRT products, that's been difficult to source.
Channel 4 News, however, can reveal that it's not just HRT in short supply. Some vital and life-saving medications are also hard to come by. This is the list of drugs where there was a shortage in March last year, and this is March this year, so nearly double the number of items with supply issues. It includes antibiotics, pain relief medication, as well as drugs used to treat people with epilepsy, and warfarin, a blood thinner for stopping blood clots and preventing strokes. Why the shortages? The reasons are as long as the list itself, but include manufacturing issues, problems with the raw ingredients, and batch failures. There were reports today of pharmacists facing abuse from patients due to these shortages. The Department of Health and Social Care acknowledged that this can be distressing, but said patients having difficulties accessing medicines can discuss alternative treatments with their pharmacist or their doctor.
Victoria MacDonald. Well, I'm joined now by Leyla Hannbeck, who's Chief Executive of the Association of Independent Multiple Pharmacies. How critical are some of these shortages? I mean, we don't want to overly worry people at home, but are they going to be unable to get some of these drugs altogether?
Well, Krishnan, pharmacists and their teams spend a significant amount of time on a daily basis trying to source out medicines for patients. And we are in a position right now that we are very worried in terms of how the supply chain is going to impact on our patients. No pharmacists want to see patients suffering, so it's very hard for us when we come to a situation when we don't know when a certain medicine is going to be available, so that we can advise our patients accordingly.
How long are the delays in some cases?
In some cases, the delays are significant. It can be weeks, it can be months. And you reported on the HRT, for example, and you've seen how the demand has significantly gone up. And in certain cases, we can't get the medication at all. So what we need to do, we need to advise prescribers to switch to an alternative medicine for the patient, because the supply isn't simply there.
Right. Well, what difference do you think an HRT czar will make? What could a government-appointed official do?
Well, what we need to do, the government needs to have a better communication with suppliers and manufacturers. With the campaigns that have been going on with regards to menopause, people are, more aware about what's available to them. And also in pharmacies, we are seeing prescriptions coming in for more supply of these products. For example, someone who used to get, 3 packs of a certain product were prescribed several packs of the product. So the awareness is there, and what we need to do, we need to have a little bit better planning in place to make sure that manufacturers and suppliers are communicated with, so that we are not in a situation where supply cannot meet demand.
But this is going to inevitably lead to some sort of panic demand, isn't it? If people think they're not going to be able to get HRT patches or whatever it might be that they need for a few months, they're going to ask their doctor to give them more supply than they would normally get.
And that's one of the concerns that we have, in that some of the symptoms of menopause can be very debilitating for some women, and they're very much they want to manage those symptoms so that they can go about their daily routine, and so it's distressing. So obviously they want to get their doctors to prescribe them for them, but the more we get prescriptions of HRT products, obviously the demand outstrips the supply. So that's why the communication with suppliers and manufacturers need to be very robust and very early on, so that we can manage the supply.
Leyla Hannbeck, thank you very much indeed. Well, across the UK, the health